Hi, my name is Dr. Wachtel. Today we're going to talk about warts. Warts are known viruses that occur in the foot routinely. They typically occur when someone walks on a surface, and that surface typically is moist. And basically, the contact that one person has after another person will cause the wart. It's a surface-to-surface lesion that occurs from transmission or contact from another skin surface. The ways of preventing warts from occurring would be to always wear some kind of sandal or shoe when walking on a bare surface. In the shower, you should be always wearing a sandal of some kind, especially in a shower that is not within your home when you're going to a gym or a hotel. Warts can, unfortunately, increase from one wart to many warts. We call them progeny, basically, and they will typically become very painful. A common wart that we see on the bottom of the foot, you will see inside, you will see little black dots. That means that the wart is at the capillary level, or the small blood vessels are at this level. And basically, when we debride down or cut down the wart, you'll see a little bit of blood spouting because it's right at the level where the small capillaries are. The way we typically treat warts is conservatively, by debriding or cutting down, trimming down the dead skin until we see a little bit of blood coming out, and then we apply medication on there. The most important treatment long-term of warts is to reintroduce that virus, that's what it is, the human papillomavirus, back into the body, and that's how we do it. We treat it by shaving down the lesion, applying a medication, and not letting it grow back by applying a very high power acid that we have in our office. Another part of our treatment is stopping moisture, because when we sweat, which typically occurs in the feet, the moisture will increase the ability of the wart to be transmitted throughout the rest of the foot. So many times in our practice, we'll see someone that has had one small wart and they've let it go, and then they have multitudes of other warts. So in our practice, we always recommend if you see one wart or you think it's wart, come in quickly so we can treat it quickly, so we don't have to worry about a variety of other warts developing from that area. So if you have a wart, go to see a foot specialist, a podiatrist. They'll treat it by removing the lesion and putting some medicine on. And there are other treatments in our practice, such as laser treatment and complete excision, where we completely excise the lesion. But our first method of treatment typically is just to treat it conservatively and debride the wart down.